Welcome to Fibroid Awareness Month 2024. I'm Sateria Venable, founder and CEO of the Fibroid Foundation. The theme for Fibroid Awareness Month 2024 is the fibroid maze, navigating a complex diagnosis. Fibroids do not just mean that you have a bad period. Fibroids can affect many aspects of our lives. Throughout Fibroid Awareness Month, we'll delve into many aspects of fibroid care. Many of the topics are a result of your feedback. The following topics will be discussed in expert panels: quality of life, can fibroids mask other issues, fibroids after 40, and pregnancy after fibroid surgery. Thank you so much for joining us. We look forward to sharing valuable information with you so you can be prepared to discuss your treatment plan with your healthcare provider.
Hello, I am Jermaine Reed, and I am a board member of the Fibroid Foundation. Thank you so much for joining us during Fibroid Awareness Month, centered around our theme, the fibroid maze, finding solutions for a complex diagnosis. In addition to being a board member, I am also a fibroid warrior. I was diagnosed and had surgery in 2020 to remove most of them. Early in my diagnosis, I found the Fibroid Foundation through social media while searching online for answers at 2 a.m. From the beginning, I felt genuinely supported through the Foundation's free education resources, access to the latest peer-reviewed research, and an extensive network of global ambassadors who volunteer their time to offer guidance and support from their own fibroid experiences. We hope you enjoy the programming created for you throughout this important month. We invite you to donate so that we can continue to support everyone in need at thefibroidfoundation.org. Join me in supporting the Fibroid Foundation. Together, we can make a difference.
Thank you for joining us for this discussion on how fibroids can affect quality of life. The fibroid conversations typically center around symptoms and treatment options. These conversations are very important when speaking with your physician about your treatment plan, but the physical aspects are not the only challenges women and menstruators deal with along their fibroid journey. Sadly, a pelvic health diagnosis can carry an emotional toll. Fears may arise in social and work environments. I know that's happened to me when we bleed through our clothing. We may be embarrassed with the changes in our bodies when fibroids grow, causing us to look pregnant. While dealing with the pain, we struggle to manage all the things necessary to maintain our work and home responsibilities. This can bring on depression, anxiety, and isolation. We need help. We need answers to help us navigate our life with fibroids. It's time to talk about our quality of life. Today, I am pleased to be joined by two renowned physicians who specialize in the treatment of fibroids to begin this much-needed conversation. I'm honored that both of our esteemed panelists today are members of the Fibroid Foundation's Medical Advisory Board. We value their input and insights tremendously. Dr. James Segars is Director of the Division of Reproductive Science and Women's Health Research and a professor in the Johns Hopkins Department of Gynecology and Obstetrics. He leads the Howard W. and Georgiana Segar Jones Laboratory of Reproductive Sciences and Women's Health Research, where he and his team focus on endometriosis, fibroids, and reproductive and ovarian disorders. Dr. Segars has published more than 160 peer-reviewed research articles and serves on the editorial boards of several medical publications. Dr. Elizabeth Stewart is a professor in the Department of Obstetrics and Gynecology with joint appointments in the Department of Physiology and Biomedical Engineering, Division of Endocrinology, Department of Medicine, and Department of Surgery. Her research focuses on alternatives to hysterectomy, innovative treatment options for endometriosis and uterine fibroids, and long-term consequences of hysterectomy. She provides care for patients with benign gynecologic and reproductive conditions and helps patients suffering from infertility or pregnancy loss. She's authored over 190 peer-reviewed publications, books, and multiple book chapters and research presentations. Dr. Segars, Dr. Stewart, welcome.
Thank you.
Thank you very much. It's great to be here.
We're honored that you're here. And I'll just jump right in because I know our audience is really looking forward to hearing more about quality of life. So our first question is the assessment of quality life in fibroids patients a new area of study? Dr. Segars?
So thank you very much, Sateria, again, and thanks also to Abby for being here too. So she'll correct me when I make mistakes, as I'm prone to do. No, it turns out that quality of life assessment in patients with uterine fibroids is something that has been done for over 30 years. And we actually, in the field of fibroid research, have a tool that Dr. Spies developed and published about a little over 20 years ago. And so that tool, the Uterine Fibroids Quality of Life instrument, is one that can be used for patients that are undergoing treatment or are interested in how fibroids may affect the quality of life. And in looking at that, there are a number of studies that actually have used either the UFSQOL or other instruments that are used to assess quality of life for general medical care or even sexual function. And so there has been a lot of research on that. So this isn't new. But what I think is new is the fact that when you look at the quality of life with regard to uterine fibroids, two things kind of pop out. The first is that treatments for uterine fibroids do improve the quality of life substantially, and this is something that's clear, whether it's radiologic or medical or surgical. And the second thing that pops out, and this is what's really concerning, is that the degree to which the women's quality of life is affected and reduced with uterine fibroids is as bad as, based on our current instruments, that with women who have been diagnosed with diabetes, and this is what women judge, or coronary heart disease, or even breast cancer. So the decrement in quality of life is really substantial in the women who are affected with uterine fibroids. And so this to me, actually, the degree to which they're affected, I'd always appreciate it on a one-to-one, but when you look at it as a totality, it's really quite substantial.
Yeah, I would agree with what Jim says, and I think it really is astounding that many people that don't have fibroids think fibroids is an unimportant disease and not worthy of study. But when we see that the quality of life based on the standardized instruments shows that women have impairment equivalent to diabetes or cancer, that really speaks to how important this disease is and how important innovating new treatments and strategies is. And I would take it even a step further, and I don't know whether you'd agree with me or not, Jim, but we'll get back to you in a second. My sense is that women still don't feel free to talk about all the impairment that they're having. That this is a theme in our research, that there's shame, and you alluded to it a little bit in the introduction, Sateria, that you have menstrual accidents, you stain the chairs in a conference room, and I've had women tell me they wait until everybody else leaves before they get up, just in case they've had an accident like that they don't go places and don't do things for their career or their family because they are scared of having an accident. They don't talk about these things with loved ones even. For younger women, there may be stigma that if they want something for their menses, that their parents may get the idea that they're wanting to have sex and have birth control. And so that opens a can of worms that they don't want to start. Or again, for people who are in intimate relationships, it may be that I don't want to have sex tonight. It may be that I don't feel comfortable having sex because it's going to be such a mess, and I don't even want to talk about that with you. So I think there's this whole unexplored or underexplored world of impairments of quality of life, and how women and other people impacted by uterine fibroids have this disease impinging on their quality of life, that we don't even have a vocabulary or a way of talking about.
Maybe I couldn't agree more. I think that the instruments were designed sometimes for just general functioning and depression and anxiety and this kind of thing, and it wasn't really designed to capture the kinds of issues that women with uterine fibroids face. So we need, even though the UFSQOL it was specific for a specific symptom, and it doesn't really kind of cut across the disease as a whole. So we have the tip of the iceberg, I think, at this point.
Yeah. And we also, I'm grateful to the Fibroid Foundation for opening up these kind of conversations, because if we can't have them in small groups, then it's hard to bring them into a medical consultation room. So even being able to talk about these with friends and loved ones is a big step for many people.
That's such helpful feedback. And one of the most frequent topics of questions that we receive are around hesitation to seek treatment or fear of treatment. And I think in many instances, our community members are looking at treatment as, they're not looking at it always as it's comprehensively impacting their quality of life, and how that quality of life could be improved greatly by seeking treatment, and seeking treatment as early as possible, because fibroids can grow in some instances and can grow very rapidly in some instances. So
well, and part of that is on us as a medical community, because sometimes women have sought treatment and been dismissed, or not believed, or only given one option. So I think there is some reluctance that is based on experience.
That's fair. And I think it's also, I really appreciate that you highlighted the shame, because oftentimes when we share with community members that there's an actual term for pain during intercourse or pain with intimacy, they seem relieved to know that they are not isolated with that particular experience, and that it can happen very frequently with uterine fibroids. So all of the information you shared is really, really helpful. So thank you for that.
Yeah. Pain with intercourse, bleeding with intercourse, those sort of things aren't typically discussed. So
True. Yes. So next question is, have you observed recurring quality of life concerns in your patients? And if so, what were those recurring themes? Dr. Stewart, I'll come to you first.
yes, I have, but I sense that there's even more there, that oftentimes that when someone comes in, there will be the first layer of concerns, but there are 2 or 3 beneath that. So that's where having some continuity of care can be helpful. So again, women may come with concerns about heavy menstrual bleeding, but really at the top of their priority list is future fertility. And in fact, it sounds like there can be major communications problems when doctors say, well, we can try birth control pills. And I hate the name birth control pills. I think of them as multifunctional steroidal medications because they're so useful for endometriosis and fibroids, but we call them birth control pills. And again, women get the sense that they're not heard when, we're talking about bleeding. If I inadvertently say, well, we could try birth control pills, because they feel like I didn't hear that they were not sexually active, or that their highest priority was future pregnancy. And so again, just to kind of unpack all of that can be a big issue and can derail the encounter, so that may be the woman that walks out of my office and doesn't come to see anybody else for 3 more years. Jim, you probably have some similar experiences.
Yeah, I think I agree with you, Evie. I think the idea of this layered things, so that one of the problems is that we as a society suppress the whole idea of menstruation, right? And so we suppress the idea of bleeding, and it too often, I think, providers minimize this. So when patients come and say they're having heavy periods and this and that, or they may not even recognize it, right? But they're anemic and so we as a profession and we as individuals too, I think, have a difficult time. The patients have a little bit of a difficult time, and we have a little difficult time. And so we need to empower women who have fibroids and empower women who have menstrual difficulties to come in and ask the tough questions and talk about things like sexual functioning, which is one of the main things that kind of pops out, in addition to, Evie mentioned this social concerns, bodily pain. I mean, if it's pain, we as a society say that's okay. But bleeding, menstrual bleeding, well, you're not supposed to talk about that. You can have pain. Pain will allow you to say, but don't talk about bleeding. Pain, okay. Don't talk about sex. Pain, don't talk about bleeding in church. That kind of thing. So I think we really do need to empower women to bring these things forward. And I agree with you, Abby. It's a lot.
And there's a clear double standard. We can have ads for erectile dysfunction drugs on sports events.
But don't have anything about bleeding.
Yeah, not even something simple like tampons. Much less getting into the more difficult discussions. But again, you can have political figures in these ads, but women are much more reluctant to talk about these issues.
You uncovered a lot with that answer. I agree with you that birth control pills, as they are called, have many purposes, and that patients are not inherently aware that those hormonal regulators can be utilized on a few different instances to help them to feel better. So thank you for highlighting that. And
it's even worse now that many people don't have access to these important medical treatments because certain insurers or certain states may label them as contraceptives and not allow you to have the appropriate medical care for gynecologic disorders and non-gynecologic disorders.
Agreed, and that's a huge concern that is devastating many women and menstruators across the United States at the moment, which is a huge issue to delve into, but I appreciate you bringing that up. It's something that is definitely on our radar screen to try to continue to support our community in whatever way we can to access the care that they need. And I think that's a great segue into what I gathered from this question, your answers to this question, which is the understanding, the empathy that you both as physicians have display and convey when you're interfacing with your patients to really help to uncover what their goals for care are and what they're really feeling and experiencing. And I think that it will, and I hope that hearing your answers will help many of our community members to expect that level of care and understanding when they're at a doctor's appointment, because that's not always the case. but it's quite refreshing to see and quite comforting, I'm sure, to hear those answers. So thank you for that as well. This question may be a little redundant, but as a provider, what quality of life information would you like to know from your patients? Dr. Segars.
So it's a great question. And I think that, Evie sort of unpacked a little bit of this when she's talking about the different levels. One of the things that I'd like to see, not only in my patients, but I think in our field, is I think we need to pay more attention to quality of life. And I'd like to see a situation where instead of women coming in having to bleed to anemia or having pain to the point where they can't function at work, that we begin to use quality of life instruments to assess women with fibroids, and so that we as a field do what they've done for cancer and inflammatory bowel disease and coronary heart disease. So you come in, you get a quality of life instrument assessment, and then they learn all sorts of things about what your goals are, and whether, if you're not comfortable asking about sex, it's in the questionnaire, right? So then it's there, and so that is brought to the provider's attention. So I'd like to see that for fibroids elevated to the level where it is now for cancer and other chronic diseases, inflammatory bowel disease, so that we begin to change the paradigm and enable the patients to bring these things forward so that that's there. So Evie mentioned fertility. That would be in part of that questionnaire. That's not something that, is particularly asked a lot of times. And this is really important. And sort of life plans. And that's also something. And the other thing that'll do is it'll allow us to measure, and you mentioned this, Sateria, the patients often have improvement with procedures, but it'll allow them to quantify this, and that'll also improve their satisfaction. In other fields, it's shown to improve the satisfaction when women come in and a doctor gives them a quality of life assessment before they see them or at the time that they see them, so that they know what the patient is suffering from.
Now, I don't know that I have had that frequently at a gynecologic before a gynecologic appointment. Great point. Dr.
Well, and I think given the prevalence and severity of fibroids, that we shouldn't really be thinking about this as exclusively a gynecologic disease. While it may be a gynecologic disorder, it has to be on the radar screen for primary care doctors, internists, pediatricians, that again, by the time you work your way up to a gynecologist, you often have pretty severe disease. And so to identify early, start to talk about options so that you don't run into the wall of finally seeing a gynecologist and being told, gee, given how bad your disease is, we only have choice A or choice B, instead of there's this whole range of topics that we can discuss.
I want to add to that too, because I think that's just a fabulous point, just terrific, because one of the problems that we have, even though fibroids are easily diagnosed with an ultrasound, is that even women with severe symptoms go 3 years before there's a diagnosis of fibroids in one study. And so, the women are suffering, but the physicians or providers are not making the diagnosis. And so you can't treat the person until you have the diagnosis. That's always very helpful in medicine. And so we really do need to make the diagnosis sooner. And the way to do that is to do what Evie said and use these instruments to get the person to the person who can make the diagnosis, as opposed to, covering the symptoms up with something.
Exactly. And not everyone has the same level of access to care. And so that's a great point, because someone may see up their primary care physician as opposed to a gynecologist, and need to have a diagnosis as soon as possible. So having these tools like assessments and ultrasounds for screening is very, very important. Thank you for that. So I'd like
Well,
to.
and I think encouraging women to be proactive as well. I mean, there are women that come in and say, I'm having heavy menstrual periods and a lot of pain. Could I have fibroids? Or can I have an ultrasound to see if I have fibroids? That sometimes kind of putting it out on the table is also helpful.
That is asking for the care that they would like to receive. Great point again. So I'd like to make a pivot to research, looking at what we've learned from some research studies in the past and talking about some exciting upcoming research that will hopefully give us some additional insights into uterine fibroids and pelvic health. And I had the pleasure of working with both of you on the Compare UF fibroid study, which I think was a very impactful study, a 5-year study with 9 clinical sites across the United States, looking at the treatment options that the registrants selected for their fibroid care. Can you tell us, Dr. Stewart, about the Compare UF research study a little and about the quality of life aspect of that study?
Yeah, so it was a great study. So again, women were allowed to choose with their provider their desired treatment. And what we found is that with all of the treatments that we studied, that with treatment, symptom severity decreased and quality of life increased significantly. So I think that that's reassuring. I think the downside of the Compare UF registry is that the numbers of patients seeking some of the less available treatments like uterine artery embolization or focused ultrasound or even medicated IUDs was pretty small. So we had the best ability to look at outcomes for the major surgeries, hysterectomy and myomectomy. But I think it is reassuring that when women choose their own treatment, that they are significantly improved following treatment.
Agreed. Yeah, it was very fascinating. Dr. Segars, would you like to add anything?
So no, I agree entirely. I think in some of the and I should mention probably, I think I did mention that Dr. Spies and Evan Myers and others, when I think of the uterine study that you mentioned, I think of Evan and Lauren Wise and a few others. So, but in the reviews that we've done recently, where we studied this or analyzed this, just to the review of systematic improvement, we see it not only in hysterectomy, myomectomy, as Dr. Stewart mentioned, but also in most treatments. In fact, we couldn't really tell a difference between the different kinds of treatments that women would take for fibroid treatments, such as either myomectomy, hysterectomy, or minimally invasive surgery, or laparoscopy, or radiofrequency ablation, or uterine artery embolization. They all sort of had an improvement of quality of life that was significant. Some a little bit better than others, but for the most part, substantial improvement. So what we don't know really is kind of a granular issue, whether some are better than others, but for the most part, it looks like it's, in general, no matter what kind of treatment you do, you're better off than if you don't. And I think that's the other thing that I think is sort of a patient-friendly thing, so that if you do want to have a conservative treatment for fibroids and conserve your uterus, the quality of life still it should improve based on what it is. And that's amalgamation of a lot of patients, and not everybody has the same response, but generally it's good. So I'm going to sort of add a little bit of granularity to that. It's not as rigorous as a Compare UF trial was, but that's what we found.
Also important information, and it's great to be an informed patient. To know your status is incredibly important. So thank you for that. So tell us about the upcoming National Institutes of Health Fibroid study, Dr. Stewart, the specialized centers for research on health disparities in uterine leiomyoma. Does it have a focus on quality of life?
Yes, it does. So this is an exciting program by the NICHD, one of the major branches of the NIH, and they put out an announcement to fund 2 centers that are devoted specially to uterine fibroids and health disparities. And Mayo Clinic is the primary site of one of them, but we're also working with colleagues in Florida and Mississippi and throughout the country, including both Sateria Venable and Dr. Segars. And then the second center is headquartered in Michigan with the University of Michigan as the primary site, Henry Ford, and Harvard University. So I think this is really the first time in a long time that there's been special funding devoted to uterine fibroid research. And I don't believe there's ever been funding devoted to uterine fibroids and health disparities. But I think, again, one of the key things, and Sateria, this was something you advocated for, is that the goal of our center is not only to eliminate disparities related to uterine fibroids for Black and African American women, but to make outcomes better for everyone. That if we just bring things to where the disparities are eliminated or reduced, we still aren't where we need to be. So we need to raise the bar for everybody. So over the next 5 years, we hope to get a lot of exciting things done. And so this will have community-based research. It will have pilot projects for young investigators, that we will have public sessions and dissemination of information. So there's going to be a lot of key elements that people should be looking for.
Yeah, it's an exciting time, and it's really wonderful that the NICHD is looking at these specific areas of the impact of uterine fibroids. So I think the outcomes will be fascinating, and I appreciate both of you with your partnership in this effort, and in regards to the impact of uterine fibroids on the community at large. My goal with just really emphasizing the impact across ethnicities is reflective of the Fibroid Foundation and the community members, and that they're folks in our community from every ethnic group, every walk of life. And while we know that the impact on women of color can be more severe in terms of symptoms, there's still a lot to uncover. So I hope that this study will really help us to make some strides for learning more. There's so much to learn. So stay tuned, community. There will be more coming. So our last question is, what studies would you both like to see in further assessing and providing support for women with fibroids to help them have a better quality of life? Dr. Segars, I'll come to you first on this one.
So I sort of kind of mentioned it before. One of the things that I'd really like to see, and the new study that you all are mentioning is really groundbreaking to a certain extent in this regard. But to bring this to the attention of the patients, and also to focus specifically on the patient involvement with regard to health disparity. So that's really huge. So that's the kind of thing I think that we need. But one other thing that I would like to see would be that in the trials that are funded by, for instance, the government and the FDA, and for drugs and medications and things like that, the quality of life would be a measure that's accepted. And so, but a few years ago, it had to be, women had to have tampons that were weighed. You couldn't take a woman's, oh, we don't want to listen to that, so we couldn't use the menstrual pictogram. Now that's kind of coming in where we can say they can quantify the amount of menstrual blood, and that's probably okay. But the quality of life instruments should be able to be used for these studies too. And that's one of the things that I don't see happening yet. But I think that that's the kind of the next step for what this is, to elevate the quality of life of women who have fibroids to be equal to measures in the blood or that kind of thing, so, or bodily pain, because it's just as significant if the patient has anxiety or depression or altered social functioning or sexual, problems that arise from fibroids. So I guess what I'm saying is I think we ought to really elevate this. So I'm really, really delighted to be talking about this, and thank you, Sateria, and I'm excited about the study that you all are doing.
Thank you. And Dr. Stewart, what would you like to see moving forward?
Yeah, so I would like to see the conversation opening up on many levels. That again, I think we do need to be assessing individuals impacted with uterine fibroids at an earlier stage in community settings. I think we haven't even started the conversation to say, how does this disease impact the people around the affected individual? I mean, I've had many people say, well, my mom couldn't do X, Y, or Z with me when I was a kid because she had her period. She wouldn't say that, but there were certain days you couldn't go to the beach, or there's certain days you couldn't go to here or there. And so I think that because of the social networks that individuals have who are impacted with fibroids, the ramifications of the impairment of quality of life extend to many individuals and many workplaces and many different facets of life that we haven't even started to think about.
So I'd like to add one thing, Sateria, if I could, because it just flew out of my mind. But in endometriosis, there's been a push for screening questionnaires and screening tools and things like that. And for fibroids, I really think that what Dr. Stewart said earlier, about the idea that the women are not diagnosed and they go kind of a long time, and there are screening questionnaires that are statistically significantly predictive for young girls who have bleeding issues. Have pain with endometriosis. But we really need to have something more that's used earlier in the pediatricians or in the internist office, so that the patients can be sort of, if you will, referred earlier and referred in a way that they can get a good diagnosis, particularly when there's issues with equity and health disparities in this disease. We know that the women who are most likely to be at risk, but yet, sadly, they're oftentimes the ones that are overlooked or don't come forward and whatnot. So I think we really do need to think about sort of quick instruments, 4 to 5 questions that would allow the young woman, girl, or whatever adolescent to be referred for treatment to stop the progression of disease earlier. So I just want to throw that out there.
Absolutely. And behind all of this is the societal expectation that you suffer through these really devastating symptoms. And when Dr. Stewart mentioned workplace, it kind of reminded me of the workplace reset, which we developed to really address the fact that women and menstruators are carrying out Herculean, work-life responsibilities while experiencing these sometimes really horrific symptoms. And they need support. That shouldn't be the expectation. And I hope that this conversation will walk us closer toward a more of a work-life balance and a more of a respect for and need for quality of life. So I'm so grateful to both of you for providing these really tremendous insights. And I don't think that these conversations specifically on quality of life have been had very frequently, but it's necessary to move us forward. And I'm so grateful for your time today. So thank you very much.
Well, thank you for the invitation and the forum to discuss this, and for all the work that you and the Fibroid Foundation do.
I couldn't agree more. Thank you, Sateria, and I hope that women will benefit from this, and maybe we pass along and then help other people.
Thank you so much for joining us during Fibroid Awareness Month for these important conversations. If you're facing a menstrual health challenge, you don't have to make the journey alone. We encourage you to reach out to us at fibroidfoundation.org. If you've missed any of these informative conversations, you can view them on our website, fibroidfoundation.org/events. We look forward to continuing to share powerful, informative, and enlightening conversations with you. Together, we can erase the stigma of silence around women's menstrual health, and together, we can make a difference. Thank you, and be well.